So when we think about innovation and we think about really considering what's possible, we ask the question, what if? And that what if question, again, helps us from a strategy perspective, but innovation to really consider what it is we may want to go forward and try to take care of. So what if technology can fundamentally change the way individual activities improve health? Or what if new processes and approaches can help individuals lead healthier lives? Or what if data can help to provide different insights around what it is that we need as healthcare leaders, healthcare providers within the respective setting? So the what if questions are, again, a strategic way for us to think about this. Now, when we're thinking about what we want to do is to also make sure that we are keeping in mind the following. One, keep an open mind, because some of the things that you may think about would be, that's ridiculous, that's never going to happen, it's far in the future. But in reality, what we end up seeing is that sometimes they come to pass. And so keep that open mind. Think about the impact that can have to your respective organization or your patients, because when you're thinking about a particular disruption, what you want to do is to make sure that you are understanding that it will be impactful and it's tied to your overall strategy. Again, part of my role at Navicent Health is Chief Strategy and a Chief Innovation Officer. Very intentional, because what we're trying to do is to try to link strategy and innovation together. More about that in a little bit. But you want to make sure that whatever you're thinking about or you're looking at is very much tied to your strategy for the organization. And then from a decisions perspective, you have to know how you'll relate to the disruption. So if you see something that's coming at you, is that something which you're going to go ahead and seize and say, this is a great opportunity, we want to be part of it? Or will you say, that's not going to affect us, we don't need to worry about that? Or do you just say, let's go ahead and wait and see? So with that in mind, there's a number of different things that we want to potentially think about from what if, and we're going to go through a series of what ifs right now. In the United States, there's been an example, although it's not in place yet, of where there's a larger market and they plan on having, and I saw this and it was phenomenal, that they're going to have this incredibly scheduled drone delivery service across a wide geographic area for lab specimens, etc. But also think about in areas that's very hard to get to. For example, if there's an earthquake or there's a hurricane, there's something that you need to be able to provide life-saving equipment or supplies to, this is a reality. So we know in healthcare there's many applications for this. Just one of the what-ifs that we're able to think about with regard to this. Another one, I mentioned the smart sutures. Is everybody familiar with this smart bandage trial that's been going on in Wales? No? Yeah, so this is very interesting. It's very similar to the smart suture, but what they're using is the 5G technology, and they're using the bandage to actually, as patients are leaving the hospital for their wounds, they're able to then measure the overall success of their healing process, etc. But there was a pilot that was in place, and they're looking to roll this out a little bit further. So what if if a bandage is able to really help communicate to, and then also help with the healing process of a patient? What if a comprehensive box is able to be in your home or your office that is able to provide what you need real time for healthcare needs? Fantastic. So we talked a lot about this yesterday with both Darren's presentation and Hector's. So I won't go into this a little bit into much detail, but what if cognitive computing and artificial intelligence combine to provide life-saving predictive information? So this was an example of a study where they went ahead and took a look at how individual physicians were able to read films and able to predict what a particular situation was going to be around hearts. And what they figured out is that the computer actually beat the physicians in this particular study. So we know that this is real. We know that this is being deployed. Hector and Darren gave us a really good overview of this as well. Not sure if you have any further thoughts around this, but just wanted to make sure that we kind of harken back to yesterday's conversation. It's a very big reality in some place right now. What if an individual that had no hope of walking again is able to ambulate because of the use of what this is, which is an exoskeleton? And we know, I was told that there's somebody, I think that there's some of this already happening in Ireland, actually, right? There's a
trial at the moment.
Okay, so you're familiar with this, right? But anyway, this is just an amazing thing for people who had no hope of walking at certain points, but now we're able to think about that again. And it's just one example of the particular use of what if we can use our gut bacteria to predict and help control particular diseases. Who here has spent any time understanding their own microbiome? Anybody? No? So you heard them reference the Ubiome, which unfortunately is a company outside of in San Francisco that had created the opportunity for people to send in their own specimens from parts of your body, which I won't go into. And then what they do is they measure how much microbacteria you end up having within your microbiota. And then they're able to tell you what you're potentially at risk for, but more importantly, just the makeup of your body. And then you can go ahead and do certain things to help kind of correct that. The reason I said unfortunate is that everybody's familiar with Theranos, right? Yeah. So it's gone the way of Theranos to a certain extent, not quite that far, and they are under investigation for questioning whether or not their technology is real or not. But there are others that are doing this. UC, I think it's San Diego, are going through, and they've actually created an entire division to study the microbiome. And they absolutely believe that the future of helping to make sure that we are working our best to have the healthiest lives we can is residing within the microbiome. So again, a different piece of kind of the healthcare field, but it's a reality that possibly is going to be coming sooner than we thought. Now this, as well as the genome, genetics, etc., pose a different and a challenging situation for healthcare providers because now there's so much data, and again, some of this may be coming from patients themselves who have gone and they've done these tests, and they come into their provider and say, hey, this is what my genome test says, and so it says that I'm sick with this, and what are you going to do about it anyway? So how we go ahead and integrate all these different data points is going to be, I think, a challenge for us as we go forward, but what if we're able to do that? So anybody familiar with what this is? Kind of. It's augmented reality. So this is just a Google Cardboard box, and this is $20. But what it does is it allows you to see virtual reality. And this is a wonderful story because, and I wish I had the video for this, but I don't. There was a baby that was, I'm sorry, John. There was a baby that was born and it had some sort of heart defect. And the physicians in the hospital said, there's nothing we can do. There's no way we can surgically take care of this. And so they said, I'm sorry, you're going to have to go home, and unfortunately your baby's not going to survive. Of course, the worst words you could possibly hear. A physician heard about this and said, I have an idea. So what he did is he took a number of different scans, put them through augmented reality, used the Google Cardboard, and what they did is they found now they had a 360-degree view of the heart. They found a way to go in behind where they weren't able to see before, and they were able to repair the error, and that they were able to save that child. The child was there. But it's because of a $20, I don't know if he used a $20 pair of glasses, but it's because of this technology that now he had insight into a different way to address an abnormality that otherwise the baby wouldn't have survived. So it's a wonderful story. What if a contact lens can be used to help with diabetes, whether to indicate and to motivate or to trigger some sort of insulin injection, or to just track what ends up happening with your diabetes? We talked about genetics to a certain extent, so what if we can predict what possible diseases we are predisposed for by understanding our genome? 23andMe, has anybody done 23andMe? I must be the only one that's doing this stuff, right? So I did 23andMe, I did Ubiome, I did it. Anyway, so... You don't want to know. You don't want to know. Fair enough. So we can just skip to the end, actually. But here, so 23andMe has been approved for screening for a number of different things by the FDA in the United States. But a number of years ago, when they first came out, they were shut down and said, no, you're doing dangerous stuff because you're predicting there's nothing that's there's clinical evidence to support this. They went through a number of different iterations of their process, and what they ended up doing now is getting to a point where the FDA is approving them for certain screening. But what you do is you go ahead and provide, I think it's blood. I think you provide blood. No, you swab I think you swab your mouth is what you do. You send it in, And they give you a whole portfolio of what your ancestry is, of course, and your potential genetic makeup. It's not at all as complete or as thorough as what it could be. There are now sequencing of the genome, which in the past was hundreds of thousands of dollars. You now can do the entire sequencing of your genome for about $1,000. The point is that there are people out there that are doing this, and again, if they go to a physician and say, here's my genome, what are you going to do with it? Well, that creates so many other different possible problems. But using your genome is going to be very interesting in the future as well. So, what if people's lives can be positively changed by quick and unexpected access to pharmaceutical implants, tissue supportive devices? So, everybody's sort of 3D printing. 3D printing now with able to use particular materials to recreate an ear or recreate a cartilage or that type of thing. So, again, I mean, helping with reconstruction or helping with a child, for example, that has, as they grow and their trachea, as they challenge, they end up being able to put new types of devices that have been printed in there as they continue to grow. So that helps with children or helps with patients to be able to live their lives in a different way. So that has a positive